Good evening all. Today we are going to say about microdiscectomy procedure in surgery. So what is meant by microdiscectomy? The micro means tiny object. Discectomy denotes the disc in a vertebra and ectomy means to cut. So microdiscectomy is one of the surgical procedure of the relief of pain and other symptoms that occur when a herniated disc in a spine presses on an adjacent nerve root. During this operation, the surgeon frees the nerve by removing small fragments of disc and bone and ligaments. So in this picture we are able to see the microdiscectomy. It is the herniated disc, the pinched nerve. So in a lumbar region, that is between L1 to L5. In that area, the patient feels very pain during the bending time, sitting prolonged period, or driving in. So this is the vertebra. This is herniated disc. This is in the lumbar region. So some of the causes of microdiscectomy that are the softener material inside the disc punches out throughout a crack in a tougher exterior. This can irritate or compress nerve and causing the numbness or pain. These are the cause. The main reason is compressing the nerve. What are the situations which cause compress the nerve? Prolonged sitting, prolonged standing, prolonged weight bearing. These are some of the day-to-day regular activities will cause the microdiscectomy, which means disc prolapse. So some of the risk factors of microdiscectomy, that means bleeding, infection, leakaging spinal fluid, injury to blood vessels or nerve in and around the spine. The technique of microdiscectomy is a mid-line microdiscectomy in which the surgeon makes a 1 to 2 inch vertebral incision in the back, lift the surrounding muscle of the vertebra and uses instrument to hold apart the layer of tissue during the procedures. We should make the position the patient in a table in a prone position. So it is very easy to make this procedure. A tubular microdiscectomy in which the surgeon inserts a series of small tubes or dilators throughout a small incision to create a corridor throughout the muscle in which to operate, thereby causing less distribution to this tissue. Endoscopic microdiscectomy, sometimes also known as microendoscopic discectomy, in which an even smaller incision is made on the surgeon, employs the miniature camera and instruments. This approach also involves less distribution to surrounding tissues. The alternative to microdiscectomy is physical therapy, may also include manual therapy techniques, that means some of the physiotherapy such as joint mobilization and soft tissue mobilizations to restore proper spinal alignment and reduce the discomfort. Chiropractic care is another non-surgical alternative that focus on the relationship between the spine and the nervous system. So here I will show you
A lumbar microdiscectomy is a minimally invasive procedure used to relieve pain and weakness caused by a herniated or ruptured disc. The herniated disc presses against nerve roots, which causes shooting pain down one or both legs, often referred to as sciatica. Using fluoroscopy, a special type of X-ray, the level of the injured disc is located along the spine. A small incision, less than an inch, is made on the patient's lower back, directly over the disc space. To access the disc, a set of tubular dilators is passed down to the spine, splitting the overlying muscles. At Spine Nevada, we use a custom expandable retractor to provide optimal visualization after the dilators are removed. This approach allows the surgeon excellent access to the spine with less disruption of muscle tissue, resulting in less pain post-surgery and a quicker recovery than traditional open surgery. Once the spine is exposed, a tiny amount of the lamina, the bone structure that protects the spinal nerve roots, is removed to create a window for the passage of surgical instruments. This is called a laminotomy. At this point, a microscope is brought in to magnify the surgical field. The pinched nerve root is gently retracted to allow access to the injured disc. Using micro-instruments, the damaged portion of the disc is removed, while the healthy portion is left intact and functions to cushion the vertebrae. Partial disc removal, or discectomy, is a necessary healthy position. The small wound is closed with absorbable sutures, and a tiny dressing applied. At Spine, Nevada, this procedure is performed.
So this is microdiscectomy. Thank you all.